Thank you for joining us. My name is Calvin Goh. I'm an occupational exposure researcher for CAREX Canada. I'll be giving you a 45 minutes overview webinar on CAREX Canada's Occupational Exposure Project. Here's the outline of our presentation. I'll provide an overview of CAREX Canada's Occupational Exposures Program, show examples of our occupational estimate results, show you where to look on our website for the related online resources, introduce our upcoming tool, eWORK, and finally discuss potential uses for our data. The name CAREX stands for Carcinogen Exposure and comes from a project developed by the Finnish Institute of Occupational Health about 20 years ago with support from the Europe Against Cancer program of the European Union. The goal of the original CAREX project was to estimate exposures in workplaces. CAREX Canada is unique because it is also looking at environmental exposures. The project estimates the number of Canadians potentially exposed to known or suspected carcinogens in the workplace and community environments. These estimates are meant to support prioritizing and targeting exposure reduction strategies and cancer primary prevention programs. We're funded by the Canadian Partnership Against Cancer, originally from 2008 to 2012. We just received renewed funding, now that extends until 2017. Our focus is on selected known or suspected carcinogens, as defined by the International Agency for Research on Cancer, otherwise known as IARC. CAREX Canada focuses on 72 substances ranked by IARC as either Group 1 known carcinogens, Group 2A probable carcinogens, or Group 2B possible carcinogens. We do not have time to go over in detail how IARC defines these categories of carcinogens. You may visit their website for more information if you're interested. Substances for CAREX were selected based on their potential for occupational or environmental exposure in a Canadian setting, toxicity level, and feasibility of assessing exposure. For the occupational project, we focused on 44 known and suspected carcinogens encountered in Canadian workplaces. For each of these substances, our objectives are to estimate how many Canadian workers are potentially exposed, where the exposures occur in terms of industry and occupation, where the exposures occur in Canada, and if sufficient information is available for the carcinogen, what level workers are exposed to. This slide shows our generalized method for producing occupational exposure estimates. Primary sources we use include information from scientific literature, data in the Canadian Workplace Exposure Database, or CWED, information from previous CAREX projects in Europe, and other Canadian-specific information on exposure from government sources. The CWED, Canadian Workplace Exposure Database, is a repository of all available occupational exposure monitoring data from across Canada. Using information gathered from the data sources, our occupational hygienists determine an exposure proportion for every job in every industry in Canada. These proportions are combined with census data to obtain the number of workers exposed, which is our prevalence estimate shown in red on the top right. Where exposure data is available in the CWED, we can produce semi-quantitative exposure level estimates, in which workers are categorized into high, moderate, and low exposure levels. Before I show you an example of how we develop our prevalence estimates, we must clarify our definitions of industry and occupation. We follow the classifications of Statistics Canada's 2006 Census of Population. Industries are classified using the 2002 version of the North American Industry Classification System, or NAICS. Occupations are defined using the 2006 version of the National Occupational Classification Statistics, or NOCS. We refer to an overlap of industry and occupation as an intersection. An example of an intersection would be welders in the motor vehicle manufacturing industry. Our occupational hygienists flag all intersections with plausible exposure to the substance of interest, then assign an appropriate exposure proportion to each flagged intersection. We multiply the exposure proportion by the number of workers in the intersection to obtain the number of workers exposed. Adding all these numbers up gives us our prevalence estimate. Let's consider some actual examples of how this procedure works in practice. Suppose we were looking at crystalline silica exposure in foundries. Specifically, we might be interested in two jobs: foundry workers and material handlers. Our results show that approximately 2,600 foundry workers and 300 material handlers are exposed to silica in foundries. I will walk you through how we calculated this right now. Crystalline silica exposure in foundries is mostly associated with sand casting. Processes such as sand preparation, core making, mold making, cast shakeout, pouring, and casting are all associated with silica exposure. We begin by looking in the peer review literature to ascertain exposure in a particular industry or occupation. For a well-characterized exposure such as silica in foundries, this was relatively straightforward. Here are just some examples of related peer review studies that we use in our assessment. For more rare exposure situations, finding relevant peer-reviewed scientific literature may be more challenging, and we may have to rely on other sources of data. We also look for government-grade literature, prioritizing those from Canada and the US to make sure that the exposure scenario we're looking at is relevant to the Canadian context. We also consider documents from other European countries where we expect industrial processes to be similar to Canada. Here, documents from the Canadian Centre for Occupational Health and Safety, or the CCOHS, as well as WorkSafe Alberta, confirms that silica is found in foundries, and thus there is the potential for exposure to workers in that industry. From the population census data, we know that 2,550 people are employed as foundry workers, job codes J122, in foundries. Because foundry workers are involved in processes that are all likely to have silica exposure, a hygienist assigned an exposure proportion of 100%, so we assume that all foundry workers are exposed to silica in foundries. For material handlers, the exposure proportion assigned was 80% because these workers are not directly involved in the sand casting process. Material handlers in foundries are still very likely to work in areas where silica dust is present because silica is common in foundries. However, some material handlers may work in areas where silica dust is not present, and this is reflected in the exposure proportion assigned. For some substances, we have adequate data for developing semi-quantitative exposure level estimates. Most of the time, data we use to develop these levels of exposure estimates are housed in the CWED. The CWED is a repository of occupational exposure monitoring data from across Canada. The database currently contains over 90,000 exposure monitoring measurements. Sometimes, when we don't have adequate sampling data, but we do have other information on how the levels of exposure may vary by job and/or industry, we can produce exposure level estimates. These are done as special cases. So right now, I'm just outlining the generalized CWED data method. There are usually 3 exposure categories for our substances based on measured level as well as the number of samples as an indicator of confidence: high exposure, moderate exposure, and low exposure. This method was originally developed by the IRSST in Quebec. For example, for high exposure, we must have 25 or more samples in the CWED, and 20% or more of these samples must exceed our threshold concentration. We choose our threshold concentrations for different carcinogens based on relevance to carcinogenic health effects in humans. Most of the time, we use occupational exposure limits set by the American Conference of Governmental Industrial Hygienists, or ACGIH. Once an intersection of industry and job title is classified as high exposure, all exposed workers from the intersection will be assigned as high exposure. For moderate exposure, either there must be 25 or more samples in the CWED, and 20% or more of these samples must exceed half of our selected high concentration threshold. Sometimes we call this half threshold limit the action limit. Alternatively, moderate exposure intersections have between 10 to 24 samples, and 20% or more of these samples must exceed our high exposure threshold concentration. Low exposure is a sign when our occupational hygienists determine that there is a likelihood of exposure, but the number of samples in the CWED and their concentrations do not meet the criteria for high and moderate exposure. Monitoring data in the CWED mostly comes from British Columbia and Ontario. We also have exposure data from BC mines in the Yukon and Saskatchewan. A number of other data partnerships are in various stages of completion and development. We are currently converting archived data from Manitoba into a digital format that will be added to the database. An MOU was also just signed with Alberta Health Services for sharing monitoring data on silica, as well as other ongoing projects. Other sources of data in the CWED include extractions from the scientific literature, and we hope to add data from the industry and other reports and sources in the future. Continuing with our silica example, the criteria for high, moderate, and low exposure are shown here. For high exposure, we have chosen a concentration threshold of 0.025 mg per meter cube, which is the current ACGIH threshold limit value, or TLV, for crystalline silica. This TLV was set to prevent pulmonary fibrosis leading to lung cancer, so we think this threshold is important for cancer associated with silica exposure. In the picture representing high exposure to silica, you can see a concrete and stone cutting worker. This is a job where most people are categorized as highly exposed in our project. The threshold for moderate exposure is 1/2 of the high concentration threshold, or 0.0125 mg per meter cube. Moderate exposure is also assigned for intersections with fewer samples, but when the high concentration threshold is met. We have shown here for moderate exposure a heavy equipment operator, in this case a bulldozer operator, because our data shows the majority of people in this job are exposed to moderate levels of silica. Low exposure is assigned to intersections where hygienists determine that exposure is plausible, but the criteria for high or moderate exposure are not met due to small number of samples, a complete lack of samples, or low sample concentration in the CWED. You can see we have pictured a drywaller for low exposure, since our exposure data indicated that most drywallers are exposed to silica, consistent in our lowest category of exposure. Here's what we have in terms of data for the two jobs we have been discussing. For foundry workers in the foundry industry, we have 864 samples in the CWED. Of these samples, 85% were higher in concentration than a threshold of 0.025 mg per meter cube. This intersection therefore satisfies the requirement for high exposure. For material handlers, we only have 10 samples collected in the foundries industry in the CWED, although 90% of these samples are above our high concentration threshold. We do not satisfy the first criteria for moderate exposure. However, due to the high concentrations of the samples, the second set of criteria are met, and the material handlers are classified as moderately exposed. Now moving on to more of our results. Here you can see our top 10 known suspected occupational carcinogens in terms of the number of people exposed. All substances listed here are IARC Group 1 human carcinogens, with the exception of Shiftwork and lead. Shiftwork is an IARC Group 2A probable carcinogen. Lead compounds vary in how they are classified, but do not include Group 1 compounds. The confirmed and suspected cancer sites of these known and suspected carcinogens are also shown. Here I'm showing the top 5 largest industries for wood dust exposure. The size of each pie is proportional to the size of the exposed group by industry, and the colors in the pie link to exposure levels, with the darkest hue being the high exposure group in all cases. You can see in the middle that residential building construction has by far the largest population exposed. However, most of the exposure occurs at a moderate level. If we look at sawmills in the lower right and wood product manufacturing on the upper left, we see that although these industries have less workers exposed overall, more workers are exposed to high concentrations of wood dust. This makes sense, since we know that the more upstream industrial practices tend to have high exposure levels for many exposures. It's also interesting to note that for wood dust, over 70% of samples from Ontario in the CWED were above the current exposure limit, and 26% were above even the historical limit. This is another example of our results, this time for solar ultraviolet radiation exposure, or outdoor work. Right away, you will notice that many workers in these industries are exposed to high levels of solar radiation. This is not surprising, since many occupations in these industries work outdoors almost all the time. Solar radiation exposure is one of the special cases mentioned earlier, where we do not have exposure monitoring data in the CWED, but where we have used other novel methods to classify jobs into categories of exposure. In this case, the high category of exposure includes workers who are working outdoors for at least 75% of their day. Shift work is another exposure where we have to use an alternative approach in order to assess differing categories of exposure. This way of presenting data is a bit different than our usual method, since we include in this pie all the unexposed population, because we think it is quite interesting to see the breakdown of shift type for the entire workforce. In other words, these 9.7 million people in the pink slice of the pie work day shifts and are unexposed. Shift work is our largest potentially carcinogenic exposure in the CAREX Canada database, with 2.1 million people exposed, shown as the high exposure group in the pie chart. This is approximately 13% of the Canadian working population. High exposure is defined as regularly working between the hours of midnight and 5 a.m. Another 2.6 million workers work other evening and irregular shifts, and we assign low exposure for these workers. We do not count these people as exposed per se, since we are not sure if they are working between the hours of midnight and 5 o'clock. However, we think it is interesting to highlight them as a group where some people might be exposed to light to night, which is the exposure of interest for shift work studies. The bar graph on the left shows the top 5 industries for shift work exposure, with results stratified by sex. The manufacturing industry has a large number of male workers exposed. In contrast, on the right-hand side of the graph, we can see that in the healthcare and social assistance industries, there are a large number of female workers exposed. This is largely composed of nurses and other caregiving jobs. Antineoplastic agents, which are pharmaceutical treatments for cancer and other conditions, are another example of a carcinogen where we used novel methods in order to produce our estimates. Many drugs used to treat cancer in patients are paradoxically known to increase the risk of cancer later in life amongst these patients. However, the effect of lower dose exposure on the workers who handle the drugs or work in or near patient care environments is less well known. Methods of measuring workers' exposure to antineoplastic drugs are not standardized and often very expensive. Therefore, there is very little exposure data to rely on. To determine the prevalence of exposure, we extracted data from a number of sources, including peer-reviewed publications on antineoplastics exposure in Canada, human resources databases, grey literature from industry and governmental bodies, and personal communications with experts in the healthcare industry and academia. Shown here is a figure for the prevalence of exposure stratified by occupation and sex. Each figure represents 500 workers. You can see that pharmacy assistants are the largest exposed occupational group, followed by pharmacists and nurses. Shown at the bottom of this slide are other workers that we identified as potentially exposed to antineoplastics, where we didn't have enough information to assess their exposure. These are job groups that could be prioritized for further research. Most workers exposed to antineoplastic agents are female. For the level of exposure estimate, we constructed a decision matrix pictured here for determining different exposure levels. High exposure is assigned for jobs with high frequency of exposure to antineoplastics and low control of exposure. Workers with low frequency of exposure and high control of exposure are categorized as low exposure. Moderate exposure is used when workers have high exposure frequency and high control, or low exposure frequency and low control. We define the level of control as having two or more of the following. 1. Industry and workers are aware of the hazards that they're working with. 2. Some kind of exposure controls are in place, such as handling protocol, personal protective equipment, or other engineering exposure controls. 3. There are monitoring of exposure for workers handling antineoplastics. This graphic shows both the prevalence and level of exposure for antineoplastic agents. The highest and most prevalent exposures occur in community pharmacies, where control of exposure is low for both pharmacists and pharmacy assistants. Control of exposure in hospitals is generally higher, leading to lower levels of exposure for hospital nurses, pharmacy workers, and physicians. Veterinary workers are assigned as moderately exposed because the frequency of antineoplastics use is lower in this setting. For the next few slides, I'll show you how to navigate to pages with occupational estimates in our website and what we have to offer in the occupational sections. From our homepage, first you'll have to go to our carcinogen database page by clicking the Profiles and Estimates button, highlighted by the red oval here, or you can go there by using the square gray button that you see in the middle of the page. The carcinogen database is the index page for all core content on our website. The left-hand menu provides access to the general information on the classification of carcinogens, the methodological approaches used to develop the occupational estimates and the environmental estimates, as well as a glossary. In the center is our list of known suspected carcinogens, along with links to their profiles, environmental, and occupational estimates. You will see some missing links in the screen grab here because not all substances have both the occupational and environmental estimates. Our focus today are the occupational estimates, so I will draw your attention to the third column here. When you click one of the little arrows in the third column under occupational estimates, you will land on the prevalence estimate page. Here are the web-based results for silica. In the workers exposed by region bar graph, you can see the numbers of workers exposed in each province and territory. This distribution is mostly affected by population sizes, so Ontario and Quebec have the most exposed workers because the population is larger. You will also find a summary table on this page. This summary table for silica shows that 380,000 workers exposed to crystalline silica in Canada. The largest exposed industry is specialty trade contractors in construction, with 141,000 workers exposed, representing 24% of total workers in this particular industry. The top occupations with the highest numbers of workers exposed, as well as the breakdown by sex of the exposed population, are also described in text on this page. For substances with level of exposure estimates, such as silica, there will be a level of exposure tab on the left and a page showing exposure level estimate results. Workers exposed to high concentration of silica are shown in the darker red color, and the lighter color section shows workers in the low exposure category. You can see the breakdown of exposure categories by population size clearly. This table shows exposure prevalence and levels by industry. You can see here that specialty trade contractors is the largest industry group, with most workers in the low and moderate categories of exposure. The Data Sources and Methods tab, which is available for all substances with occupational estimates, describes our data sources, how the prevalence estimate was estimated and calculated, and how the level of exposure estimate was developed. The definition and thresholds for exposure levels are also found under this tab. If you go to the Data Sources and Methods page for crystalline silica, you will find the detailed methods I have described for you today. This is the prevalence estimate page for wood dust. Again, we see exposure by province and territory. Because BC has a large forestry and wood products industry, we see more workers exposed than what we might expect based on the population of the province. The summary table shows that 340,000 workers are exposed to wood dust in Canada. And again, you see the proportion of each industry that these numbers represent. For example, we can see that wood dust exposure is more prevalent in sawmills and wood preservation facilities than other industries. If we wanted to reduce occupational wood dust exposure, for example, based on this result, we might consider having sawmills and wood preservation establishments as our priority, because wood dust exposure is a lot more frequent in this industry. This slide is the level of exposure page for wood dust. You could see that while most exposed workers are in the moderate exposure category, a significant number of workers, 93,000 of them, are in the high exposure category. The number of workers in each exposure group are also shown here. If we look at the table in some detail, for the top two industries, building construction and wood product manufacturing, you will notice immediately that the distribution of workers in different exposure categories are very different. Although a large number of people are exposed in building construction, all 110,000 workers exposed are in the moderate and low exposure categories. However, in wood product manufacturing, most workers are exposed in the high exposure category. The eWORK is an upcoming tool that allows different custom queries of our results database. It is a Microsoft Excel pivot table that allows exploration of the data and results in a number of different ways. This particular example shows a query for silica exposure for all Canadian industries. Industry here is summarized at a higher level of detail, but they can be expanded to see more detailed categories underneath. This is another sample query for silica exposure, showing all exposed jobs in the foundries industry. You will notice that foundry workers and material handlers, our previous examples, are both listed. The numbers are a little different because we round our numbers before reporting them. This example shows all foundry workers exposed to silica in different industries. Not surprisingly, you can see that most of them work in the foundries industry. But you can also see further down the list that metalworking machinery manufacturing and motor vehicle parts manufacturing also have quite a few foundry workers exposed. The eWork tool will allow users to view our results in any available dimension, including job, industry, province, sex, and exposure level category. Method transparency is one of our key strengths in CAREX Canada. For both the occupational and environmental teams, our methods are fully described on our website. The methods we use to develop our estimates are also practical, systematic, and rigorous. With slight modifications, our methods have also been applied to estimate exposure for substances with very little available monitoring data, such as solar radiation, antineoplastic drugs, and Shiftwork. We have also created an information repository that uses Canadian-specific data. Our study also highlights data gaps in terms of exposure monitoring. Our methods do have some limitations. Sometimes it is difficult to assign appropriate exposure proportions to industry occupational intersections due to the lack of information about the work environment for the intersections in question. We have less confidence in these estimates and have noted this in our documentation. Because the collection of exposure data in the workplace has decreased substantially in recent years, our data in the CWED mostly come from the 80s and 90s. This is less of an issue if the patterns of use have remained relatively similar over time for the substance in interest. However, if there were significant changes in the use of a substance, the accuracy of the exposure level estimates may suffer. We make every attempt to consider current use in our estimates. And finally, since our approach was to look at exposure by substance, our estimate numbers cannot be simply added when dealing with multiple carcinogens, since any one person may be exposed to a number of different agents. Our data can be used for a variety of purposes by different groups. For instance, our results can highlight groups at risk of high exposure. Our results also allow interprovincial and international comparisons. help set priorities for cancer prevention, and predict future cases of occupational disease. Our data may also be used in epidemiologic studies. Our WOOD data is already being used as a platform for developing a job exposure matrix for a study. We are always interested in expanding our network of CAREX knowledge users. Here are some of the ways that you can explore our data and connect with us. By visiting us on our website, signing up for our e-bulletin, and following us on Twitter. You can also email us at info@carexcanada.ca. Thank you very much for joining us today.